Hello everyone, my name is Shanthi Viswanathan and I'm from Kuala Lumpur Hospital, Malaysia. I'm a neurologist who's interested in access and trying to work towards it. I'd like to thank the MSIF for giving me the opportunity to speak to all of you today. And I'd like to briefly share with all of you about the MS movement, the advocacy work that's being done here in Malaysia, pre and post the WHO EML application. So this is a brief outline of the talk today. So I'm just going to try to move to the next slide. So this work that we're doing is going on at many different levels. It's being carried out at the Ministry of Health level, the neurologist level, the community level, as well as the engagement with the local pharmaceutical. And there have been some gains. So just to put things into perspective, the current treatments available for MS in Malaysia are mainly public funded, and there are no local on-label generic or biosimilar drugs for MS. Currently, we have a number of on-label treatments. There are roughly about 8 classes, and some of the drugs like ocrelizumab here, they are available on a named patient basis only. We have a number of off-label treatments available locally, and if you look on the far right of the screen, the ones highlighted in red, these are the drugs which are only available in the hospital formularies within all the 13 states in Malaysia, the interferons, teriflunomide, and fingolimod. We also have off-label treatments, rituximab and azathioprine. So what advocacy work has and is being done currently at the moment, before as well as after the WHO EML application? So I'm going to share with you what work has been done at the national level within the Ministry of Health, as well as the neurologist level. Before that, I'd like to share with all of you a very encouraging case study or collaboration that happened between or success story from our gastroenterology colleagues in Malaysia, and share with you the wonderful work of collaborative efforts that were conducted between the Ministry of Health, the gastroenterologists, and the WHO in their endeavor to bring hepatitis C treatment to patients with hepatitis C at a cost-effective manner. Now, this success story was a great encouragement as well as example to us neurologists to persevere in trying to bring MS drugs onto our national EML. So as we all know, hepatitis C treatment with directly acting antivirals is expensive. The cost is about 300,000 for a basic 12-week treatment with sofosbuvir. Now, historically, access to hepatitis C has been very limited, and Malaysia has about 400,000 hepatitis C patients. The generic version of sofosbuvir in combination with remdesivir is a cheaper option and was trialed for patients with hepatitis C in Malaysia. However, the Ministry of Health had problems to access the originator sofosbuvir, and these price negotiations were unsuccessful. So they decided revolutionarily to bring in a generic version of sofosbuvir, and this had not been done before, through a process called compulsory licensing. And they worked together with the DNDI, or the Drugs for Neglected Diseases Initiative, to do a drug trial with unproven remdesivir and generic sofosbuvir. So DNDI launched a phase 2-3 trial in Malaysia and Thailand to assess the efficacy, safety, tolerability, as well as the acceptability of a 12-week and 24-week remdesivir and generic sofosbuvir regimens. This trial was sponsored by the Malaysian as well as the Thai Ministry of Health in collaboration with Doctors Without Borders. So this was the publication that came out in 2021 in Lancet Gastroenterology. And very quickly after this publication in June 2021, the National Pharmaceutical Regulatory Agency of Malaysia granted conditional registration for remdesivir. So in 2022, remdesivir was officially launched in Malaysia with the first patient treated with a combination of remdesivir and sofosbuvir. In 2023, remdesivir was included in the National Essential Medicine List and the Ministry of Health Medicines Formulary. That means it's available in all the state hospitals in Malaysia to be rolled out to patients with hepatitis C. So this was a great success story. Just to add, WHO recently, at the same setting as the EML application for MS, recognized this effort and approved the use of remdesivir in combination with sofosbuvir, and has also listed it on the WHO EML at the same sitting as that for the MS drug EML application. So this listing is important because it shows how a journey for this particular drug has helped in providing affordable access and equity, especially in low and middle income countries. So in this study, one of the barriers that was identified was basically these unfruitful price negotiations, which failed, and Malaysia had to invoke compulsory licensing to enable the import of generic sofosbuvir, as it is only allowed to be distributed in certain countries with the present criteria. So this highlights to us middle-income countries, as we see in this particular publication in Lancet Global Health, that middle-income countries struggle to procure generic versions as they are excluded from voluntary licensing agreements that allow only specific countries to procure generic direct-acting antivirals from manufacturers. So the successful remdesivir development example was successful because, firstly, three factors: country leadership, the ability to look at the problem as well as negotiate for compulsory licensing in Malaysia, which was not done before. Secondly, successful drug development of a novel drug, remdesivir, through global collaboration in a middle-income country, as well as having industrial partners who chose to maximize societal impact rather than profit. So now coming to the example of the advocacy work for MS from the neurologist point of view in Malaysia, as well as the Ministry of Health. We learned from this, and there was a stakeholder meeting at the National Neurology meeting in July 2022, and the issue of availability, accessibility, and sustainability of medications for MS was brought up. A unanimous decision was made to discuss at the National Therapeutic Drug Committee meeting to include MS drugs on the EML, and this was a momentous discussion because it had never been brought up before. And a survey that had been done a couple of months before this meeting found that 13 state neurologists from all over Malaysia, when asked what are the common drugs that they would use for MS based on the current evidence and what was simple and easy to access for MS as well as neuromyelitis optica spectrum disorder, and they outlined interferons, rituximab, and teriflunomide. So the criteria for suggesting these drugs to the National Essential Medicine List Committee were that the drugs were simple to use, they were easily available, evidence-based, easy to monitor, there was sustainable supply, and they included both on-label and off-label drugs. So these were the drugs that were chosen: interferons, teriflunomide, and rituximab. So coming to the National Medicine List in Malaysia, the Malaysian National Essential Medicine List was first approved by the Ministry of Health in January 2000. Since then, in line with the Malaysian National Medicines Policy to ensure universal access to medicines, the EML has been updated every 2 to 3 years following the publication of the World Health Organization Model Essential Medicine List. So that means the Malaysian EML follows on very closely to the WHO EML. So this EML is a list of basic medicines that satisfy the national healthcare needs of majority of the population. And the medicines are to be available and made accessible to individuals and communities in appropriate quantities with guaranteed quality and at affordable prices. So following this application to the Malaysian National EML Committee, 2 drugs were successfully included in the national EML. Firstly, as you can see here, the interferons and teriflunomide from the on-label group, and in the off-label group, rituximab, including quality assured biosimilars, for the first time had an indication for multiple sclerosis. And this was included in the complementary list part of the national EML. So here's the journey. Firstly, the need for MS to be treated was the discussion was at the National Neurology Committee level. Then subsequently, this was brought up at the National Therapeutic Drug Committee and the National Pharmaceutical Regulatory Agency level and the Ministry of Health. Then following this, it was brought successfully into the National Essential Medicine List. Then subsequently, the approval was obtained. And now where are we? We are at the implementation stage, where we are engaging the MOH at various levels in terms of trying to access these drugs at the hospital level by suggesting certain ways, such as coming up with a working paper on MS drugs, tender discussions, procurements, revision of the clinical practice guideline. So one such effort that is being made currently in the country is coming up with a working paper for the entire country for MS. This has been submitted in mid-2023. And this working paper calls for, number one, provision of drugs, especially high efficacy treatment at reduced costs, and suggestions of methods to do this, knowing that we already have 3 drugs on the EML, and opening up the discussion for other drugs to be included, improving MS care nationwide, especially access to doctors, and including more high efficacy treatments on the EML. The other area that we're looking at as neurologists is updating the clinical practice guideline on management of MS, because there have been many new drugs since this guideline came out in 2015, and we may adapt or adopt other guidelines that are been released globally. And we're looking at on-label and off-label data and the new data that's available for the newer on-label and off-label drugs. At the community level and pharmaceutical level, the Malaysian Society for Multiple Sclerosis is growing stronger. There has been some collaboration with MSIF, namely at the recently they celebrated the World MS Day, and also worked together with MSIF to produce a few videos on access to treatment in Malaysia. So there is good work that is going on at this level. There's also discussion by members of the MS Society Malaysia to come up with an advocacy letter. This is an example of the letter, and it's very much similar to the tool provided by the MSIF, where there is discussions about writing to the MOH with regard to improving availability and access to treatments for MS drugs in Malaysia. At the pharmaceutical level, these discussions are very preliminary. There are discussions with pharma for those who are, for the drugs that are already available on the EML. Some preliminary discussions are ongoing with regard to reduction in the price of these drugs. And of course, the recent WHO listed EML drugs, there's also discussions on applying for these WHO listed EML drugs to be included into the hospital formularies, and from there on, discussions to include it in the National Malaysian EML. So with that, thank you for your attention. I just want to share with you that this is not only occurring or going on nationally in Malaysia, but there's also exposure through a recent presentation of MSIF tools for advocacy at the recent Association for ASEAN Nations, that a meeting that was held in Vietnam in August 2023. Thank you very much for your attention.